Hi everyone, listen up. I have 7 facts that you need to know before you have a gastric sleeve. Now, my name's Sonia. Welcome to my channel. On this channel, we talk about health and lifestyle and travel. And I am an accredited health professional. I also am accredited in lifestyle medicine. And on this channel, we talk about health topics that are research-based, valid, current, and definitely have references linked below as well. Number 1 is having a sleeve gastrectomy will have great weight loss results. Weight will just fall off you. However, as we know, the reason why you are having a sleeve gastrectomy is because you couldn't maintain weight loss. That's what the participants and that's what research shows, that those who seek weight loss surgery actually can lose weight. They just can't keep it off. So when you have this surgery, the weight loss is extreme in the first year. And then definitely depending what you do and your habits that you put in place depends how well you will be able to keep the weight and maintain that weight. So research says that within 3 to 5 years, you can gain back 50% of the weight that you've lost. So when you're seeking a bariatric surgery, ensure that you have allied health professionals such as nutritionists, psychologists, clinical nursing staff who can actually help you both preoperatively and postoperatively on your weight loss journey. Because studies and research show that if you can maintain your weight and put in good strategies, whether it's behavioral strategies and the way that you eat and all those things in that first year, that you will have a very good result in maintaining your weight loss. So that's great, isn't it? Number 2 is to have surgery, you must have a BMI that is greater than 30. Now, what is a BMI? It's body mass index. You can find it in the description box below. I have a link that you can follow. You put in your height and weight and you can find that out. And definitely if you have a BMI of 30 and above, you are considered obese. And then if you have an associated comorbidity such as hypertension, diabetes type 2, joint problems, things like that, then you are definitely able to have or considered able to have bariatric surgery. The third thing that you need to know is you need to be in, particularly here in Australia, a private health fund. Now, why? Because here in Australia, not much money is given by the government in the public healthcare system. And there's a wait of about 3 years before you actually get to have your surgery. If you join a private health fund, and this is why our private health funds bear the brunt of bariatric surgery, health funds are joined for a year. They have to wait before they can have surgery. Once the year is up, the person has surgery, and then as soon as that's done, they opt out of the health fund. Now, this is the current system as it stands. I'm not saying it's right, it's wrong. I'm just saying it is what it is. The other way that you can also access money for surgery is through your super, and you can apply to have that and withdraw money out of your super for weight loss surgery. Number 4 fact is, depending on your weight, your age, and the condition of your skin elasticity, you will have excessive skin folds after weight loss, particularly extreme weight loss. Put some pictures beside. Some of the pictures are a little bit in your face. However, this is what happens when weight loss happens. There's a lot of skin left behind. And often this, no matter how much exercise you do, no matter how much toning or products that you can apply, you cannot get rid of this skin. And for some people, just having this skin, hanging around on them is very psychologically a problem for them. And definitely it's hard to disguise and to keep in control as well. Plus, the weight of that skin often in people actually add to their total weight. So once that is removed, that's extra kilos that also come off their body as well. So definitely keep in mind that after you maintain a certain weight, usually a year after surgery, then you may want to consider body sculpting of some sort to get rid of excess skin. And usually this costs from anywhere up to $8,000 and above. And so you need to be saving for this. And you need to ask about this at your consultation with your surgeon, as otherwise this is often forgotten in preparation of the patient. Number 5 is out-of-pocket expenses. Now, with surgery, even though you might be using private health fund, there are still out-of-pocket expenses with your anaesthetist, with your surgeon, with the gastroscopy that you may have to have like prior to your surgery, with Optifast drinks, pre-op, post-op medication. All these things all add up and can add up to, say, $6,000 out of pocket. So ask about the cost, total cost, and definitely, if you can get an itemized account of things. And the surgeons and the bariatric surgeons' rooms, they don't have anything, no need to hide costs. So being transparent and open with costs is a good thing, because then you know how much money that you actually do need. Number 6 is surgery is not without risks. There are risks associated with all surgery. However, with a bigger body mass, then you need to make sure that you are having your bariatric surgery or your gastric sleeve in a larger hospital that has an intensive care unit. And this is because of associated comorbidities with obesity and airway management, post-op pain control. So often after a sleeve gastrectomy, a patient may be required to go to ICU or intensive care unit for just an overnight admission initially, and be transferred to the normal wards the next day. And this is just so that they get more close monitoring so that they can be observed, and if there are any complications that they are picked up more quickly than, say, on the general ward. Other problems can be things like gastric leaks. These are usually picked up within the first day or so, and can be problematic. It's a return to theatre. Other things in the long term can be things like vitamin deficiencies, definitely vitamin D. A lot of obese people are already deficient of vitamin D pre-op. Definitely after surgery, this can be a problem. You just need to have good medical attention, whether it's the care of your surgeon or whether it's the care of your general practitioner, keeping an eye on you and definitely doing blood tests to make sure that you're not deficient in any of the important ions and minerals that you should be having. Number 7 is post-operatively, you will experience pain, particularly epigastric pain. A lot of patients forget that they will experience this pain. There's not a lot that can be done for that particular pain. I have given lots of pain and analgesia to patients with this pain. There's not a lot that actually removes it. However, any other pain is easily generally fixed, but definitely epigastric pain is just one of those things that the patient will and can experience. Definitely don't want patients nauseous or vomiting post-operatively. Recovery will make sure that you're sitting upright so that your lungs can expand. Plus, if you vomit, it will, of course, come out this way rather than back down your throat and into your lungs. Definitely not a good thing there either. You'll be encouraged to take nice deep breaths, and when you return to the ward staff will actually try and get you up and out of bed within the first 6 hours. This is to decrease the risk of complications of embolus. You can get embolus or a clot in your legs, your lungs, your heart, or your brain. and we don't want any of that. So there are the 7 things that you need to be aware of when you're having a gastric sleeve. I hope that's been really helpful for you. Check out the description box below. Have a read of my master's thesis and follow any links of the journals that are supplied as well. That's it for me. Bye for now.